if somebody is really stuck, it's starting to impact their well-being and they're feeling confused, they're ruminating about where do I go from here. For 80 to 90% of people who contacted me thinking that they needed to leave medicine actually found that they didn't. They just weren't really sure what it is that they wanted and needed and didn't have the skills to negotiate around that. The mistake that I see, I suppose, most commonly is that people try to fit themselves to an option rather than taking a step back and actually working out what it is that they want and need first.
Thank you for joining us today. I've got a special guest, Dr. Fiona Day, who is a chartered coaching psychologist. She's also a master practitioner, a former doctor, and she has been on this podcast before, but she's coming back and she's got really interesting insights to share with us today. Hi, Fiona. How are you doing?
Hi, Erwin, and listeners. Really great to be here again today. Thanks.
Great. So for people who might not know you, tell us a bit about yourself.
So I've had a career in two halves. So the first half was as a public health consultant and a board level medical leader. But when I was an undergraduate, I did an intercalated degree in psychology, and part of being a public health consultant is that you do manage a lot of people and you do a lot of leadership and partnership working. And I found that as my career was progressing, I was getting most satisfaction from sort of supporting my staff around their careers, around their leadership development and around their well-being. And so eventually when public health landed in local government, I decided I was going to make quite a significant move and retrain as an executive coach and go back to my roots in psychology. And I've just retrained as a chartered psychologist, which is an award that I was granted just a few weeks ago. So that's kind of my career to date. I've been mainly based in Yorkshire and Humber. I worked a bit in Scotland before. I've led teams of up to 25 people. But the last 7 years, I've been working independently as a coach for doctors and public health leaders in the UK. And internationally, about half of my clients have been GPs, which I know is will resonate with your audience. So they're GPs either kind of newly in post as salaried GPs through to GPs in very senior leadership roles, GPs as chief executives of quite large healthcare organisations. So those are the kind of clients that I work with. It's always around their professional lives, so their leadership, their careers, their well-being. I've worked with over 350 in the last 7 years.
That's great. It's great to see that your career has evolved and now you're a chartered psychologist. Congratulations for that. I understand that you've also got a new paper published on the BMJ Leaders.
Yes, so all happened in the same week. So I got my Chartered Psychologist Award, and also I had a publication in BMJ Leader, which is around, it's a before and after study of 80 senior medical and public health leaders in the UK, their before and after scores, which shows a statistically significant improvement in their well-being of 17.4% before and after working with me. So yeah, it's really exciting.
That's great. So tell us then, in terms of the landscape of general practice, what do you see among the people who you've coached? Because it seems to me that it's very difficult nowadays. Many GPs who are getting a sense of they can't carry on like this.
There are, significant challenges on all the healthcare workforce, and I think probably particularly in general practice in the UK, and that it seems to be becoming, more pressured as numbers reduce, as patient demand and patient need increases. When I was in my medical director role previously, then, I did a lot of developing GPs as leaders as we set up the new clinical commissioning groups and the new kind of leadership landscape, which is really, really important, isn't it, that we have GPs in leadership roles. But then it does mean that people are pulled in multiple different directions, are taken out of the practice. And great that, we have GPs in leadership roles and able to develop themselves in that way. And then there is a kind of consequence as well. But the bigger issues are, systemic and need resolving at a sort of government or level rather than what I can do as an individual with somebody. But yeah, those challenges are very real and the pressures are very acute. I think, certainly during COVID, people were under a huge amount of strain, and that's really, there's been no real respite, I think, for GPs since then. They've kind of, had to radically change the way that they work and deal with COVID, and then the challenges in the whole system that GPs bear the brunt of, because they are the open door, they are the local to home, the familiar face, and the level of demand is significant, isn't it, for, with my public health hat on, a wide number of reasons why that was already happening, but definitely kind of exacerbated in recent recent years. And, without going into the politics of it, there are a lot of drivers of the challenges that are felt in primary care.
Absolutely. So at an individual level then, what have you found to be traits of GPs who are thriving in their practice?
So that's a great question. So, I think that people who thrive in general practice, it's where there is a strong team. There is that sense of connection, of camaraderie, that they're all in it together, that they're able to kind of work really well as a team. And teams don't just happen, they need to be grown and nurtured. It takes a lot of leadership, both, to lead within a practice as well as to lead at scale outside of the practice too. So GPs that thrive at work, I think it's where there is a really effective team. Probably also, I'd say, they're properly resourced, they've got great systems and processes, and there's all of that kind of side of things is working really well as well. And they're in a broader, more supportive environment too. But in terms of the actual practice, a practice where they do collaborate, where they see each other in person, where they have strong kind of professional bonds between them, and a lot of support that they can, if somebody's struggling, there's a bit of capacity in the system to flex around what that person needs, that they get time to kind of recover and re-energize. But I think in terms of flourishing, I think it's definitely around that feeling supported in the practice and able to enjoy their work, and to kind of also able, I think, for most doctors, they want to be able to build the relationship with the patient, the person in front of them, and with their professional colleagues, and to be actually able to do what feels like meaningful human to human connection work where they're making a difference. And when, you take a really highly qualified GP that loves to work with people in that way, and they're having to do, a lot of paperwork and admin and on the computer, and that's kind of not really necessarily a great fit for many people. So I think where people do get to feel that they are contributing, they're making a difference, they're able to take that more holistic perspective with a patient, which needs time and effort and, resource from the whole system to allow that to happen.
Yeah, it sounds like the environment is really important, and having this sense of belonging, so that camaraderie. So you mentioned that these are things that don't just happen. Then, as a person who has led other teams, and what are the ingredients that would help to instigate this type of environment, Fiona?
So in terms of the evidence base around highly performing teams, there's quite a well-established evidence base around that. So the team has to be really clear on its purpose, on its vision, what it is that it's trying to deliver, what is it that only this team can do. And we often take it for granted that it's kind of obvious what primary care should be doing because there's a standard contract, or it's kind of you meet your competences as a GP trainee and that's the job kind of thing. But actually being explicit as a team, what is it that we are trying to do, the thing that every member of this practice can really kind of get behind, whether no matter what age or stage of your career you're at, or no matter what role you have within the practice, that's something that unites everybody together, is having a clear sense of purpose, of vision and mission, that kind of that core sense of direction. And then having properly resourced team is another thing, that they've got, the staff have the resources, the environment they need to work in, there is enough people, all of those kind of things. Then there's the culture and the ways of working. How do we work together? How do we kind of communicate? How do we hold meetings? How do we engage people? How do we work with our patients? How do we make sure all the staff feel nurtured and valued? So these are some of the elements of a high performing team. And also a high performing team needs really to be quite stable over time. And change is so much the new normal, isn't it? This kind of constant coming and going and turnover of temporary staff and people not staying long. But actually, to really do its own best work, a team needs to go through the different cycles, which is called forming, storming, norming, performing. To actually get to performing, you need to have quite a stable team that can really kind of gel together. So can be a challenge in the modern environment where everything is really quite dynamic. So these are some of the factors that's relevant here. And I think back, when I was a GP registrar about 23 years ago, what primary care was like then and what it's like now. There's a lot of commonalities, but there are a lot of things that have changed as well. The much more use of IT, much more kind of structured approaches in terms of how protocols and IT and how that's used, but also so much more responsibility on primary care, and the team needs to be able to respond to changes within the system because they do end up being the kind of the backstop that has to pick up everything. So, but there are very specific evidence-based things that teams can can do to be, more high performing.
So in your experience, having worked with medical leaders, what are the common pitfalls that you see that lead to practice not doing very well on these common traits that we've discussed?
I think when people are tired and under pressure, it doesn't bring out the best in them. We all know that, if I'm really tired, then I can go home and be a bit ratty or whatever. So I think, these kind of human traits play out in the workplace. When people are tired, hungry, under stress, struggling in themselves, then they don't bring their best selves to work. And then the kind of, relationships can then become a little bit strained. And then there's a bit of a domino effect around that. So I think, leaders' role is to make sure that the practice is as well resourced as it possibly can be, and that they set a really positive culture in terms of behaviours and how they work together. And actually, leadership is a relational business. It's all about people and relationships and how you relate to each other, having really strong models of communication that are very empowering and adult to adult, and that we're able to self-regulate, we're able to manage our own well-being and our own emotions so that we can bring out the best in other people without kind of inadvertently making things worse is a big element of leadership, I think, in terms of that, having the insight into what we call it self-awareness, the awareness of ourselves and our impact on other people. The kind of emotional intelligence side of leadership, I think, is a really important area for all of us to develop. It's not something that we ever get there. Everybody's reasonably emotionally intelligent probably already when they start off, aren't they? But actually, how can we be even more, take it to the next level, is the journey of a lifetime. It's not something that you ever kind of tick off, right? Well, I'm there. I'm always a perfect communicator in every moment. That's not realistic, but we can aspire towards becoming increasingly skilled in terms of how we handle ourselves and other people.
Are you enjoying this video so far? If you want more insight every week, then you might be interested in Fulfill Friday. This is a weekly newsletter in which I share exclusive insights on things I'm thinking and what I'm working. This is what some subscribers of Fulfill Friday have said. Join over 700 subscribers so you don't miss out on exclusive insights every Friday. Click the link down in the description below. It's completely free. Sometimes what I find is that GPs are in the reaction mode where they don't have much time to think about the leadership roles, how to manage the team. They're just dealing with one crisis after the other. And it's very difficult when you're in that mindset to be able to plan and think about leadership, building relationship. So how do we use strategies to switch from that reaction mode to be a bit more proactive in planning?
The secret, isn't it, really, to leadership is that you cannot lead effectively if you are just firefighting and being reactive all of the time. All you can do in that situation is just to do your best to try and cope. And there are times when that is the appropriate thing to do. There is a crisis and and it needs a kind of hands-on approach. However, thinking ahead, being strategic, thinking 5 years ahead, 10 years ahead, what does this practice need to look like? How is the landscape around me changing me? How's the patient population changing? Where are we going in the longer term? That kind of being strategic mindset is different from dealing with the kind of the immediate crisis in front of us. And we're not really trained how to do that. Most doctors, we're trained to deal with the kind of the immediate in front of us and maybe look a little bit further ahead. But that process of learning to be very reflective and take a step back, which is a little bit like, so a metaphor would be when you're in the middle of it, you're kind of on the dance floor, but we want to learn how to get higher up the balcony, so into the dress circle and onto the first floor and the upper balcony, that kind of thing, and be able to look down and see, right, what is happening, what needs to happen to make things work better here. That process of being able to take that step back is something that's really hard when you're under huge time pressure, because it's kind of like, it's very hard to weigh up the immediate task list of patient things that need to be done that are going to make an immediate difference to people, versus feels like a luxury, like an indulgence, I think, to many leaders to actually take that time out. But actually they need that thinking space, that head space, to be able to know all of that, that's all of that is out there and it's waiting for me when I go back into it. But to be able to take a step back and look at the whole and work out where we're going as an organisation, as a team, as a practice, and be able to make skillful decisions to lead the practice forward from there is something that needs conscious effort to carve out the time and the commitment and support from other people to allow people to do that, because it's very easy when you're in the middle of trying to deal with the immediate crises to feel like it's it's not a good use of time, to making sure over the course of a week, say, that you have enough of that strategic time. That kind of little bit like going off grid is a metaphor that I would use with my clients around, a bit of time where people can't contact you, where you can just take yourself out of the immediate environment, be able to think clearly about what you need to do here, because most people think ahead when they do get the opportunity to do that.
Yeah, so I have noticed that there is this thought of when we're busy, it's good, we're doing something productive, whereas this time of reflection and planning is not something that people value as much, or maybe they don't have enough time, or it could be they don't plan the time to do it.
So, I really recognize that as a very common thing that I hear from my clients, senior medical leaders or senior GP leaders who say, well, I feel like when I'm being busy, or that other people feel that I'm being useful, or, if I have a full diary, then that means that I'm being useful. And then in the same session, they might also say, well, actually, when I'm in a one-to-one with somebody, I really need to find a way to be more present. And the only way that I can do that actually is to be less busy and not to kind of feel like I need to pack everything in, that kind of, if I've got a back-to-back diary, actually, what does that tell other people in terms of how I am being strategic? Oh, actually, if I'm going to be with a patient, or I'm going to be doing my admin, or I'm going to be leading the practice team meeting, actually being prepared, having a bit of time to think beforehand what you want to get out of your one-to-one, say, or out of your team meeting, present in the moment. And this is what we call the vertical aspect of leadership. So leadership, if you think of it as practical things, but the horizontal, the kind of, how to delegate, how to line manage, how to prioritize, all of these kind of practical things that are things to learn, but that how to learn how to be strategic, how to be present, how to be really conscious in your communication, how to have presence, gravitas, that side of things is often an area that people really, really enjoy working on as in coaching, because it's something that you don't learn it from a textbook, you learn it from learning how to manage yourself.
In your experience then, have you had people where you found that they were a little bit disillusioned, or even lost the passion for medicine? Maybe they lost that curiosity or something. What happened for them to actually transform and be able to get back to enjoying what they do again?
Yes, I see that all the time. 80 to 90% of people who contacted me thinking that they needed to leave medicine actually found that they didn't. They just weren't really sure what it is that they wanted and needed, and didn't have the skills to negotiate around that. So there's a kind of that side of things in terms of like really understanding what people need to be able to do their own best work and to negotiate around that. And once you're clear about that, that's always the first step. You might not always be able to negotiate it. This is kind of what's called job crafting, and where you change the role that you have to better fit you. But lots of people do feel that they need to leave, but don't actually necessarily need to do so. And of the research that was just published, my paper in BMJ Leader, in terms of the improved well-being, the two domains that the improvement was most marked in was feeling positive about the future and feeling able to make my own mind up about things. So there's something I think about the process of coaching that really helps people to get clear, actually, what it is that they want and need, able to make their own minds up. Also that sense of, re-engaging with, a new kind of vision, a new direction, whatever it is that they're trying to create for themselves, that they then feel optimistic, actually, like I know what it is that I'm trying to do. Because actually the truth is that modern careers, including medical careers, are hugely complex. It's not something, there's so many multiple different dimensions around motivation at work. And now that there are so many different options, you can be a GP and have this amazingly rich portfolio career, which wasn't really available to people 20 years ago now. But that comes with its own set of challenges, because, well, how do you create that and how do you make that happen?
I'm seeing more GPs interested in portfolio careers. They find that they get a sense of fulfillment by doing other things rather than just being in a clinical role. In terms of your thoughts process, as in how do people can get that clarity and find out which role to pursue, what would you say to start from?
So it depends on the kind of the level of challenge or difficulty that somebody's facing. So if somebody is really stuck, it's starting to impact their well-being and they're feeling confused, they're ruminating about where do I go from here, feeling lost, feeling stuck. If you're feeling like that, then that's about getting expert careers guidance help. If it's just a more kind of okay, just wanting to make a few tweaks here and there, it's probably something that they can do themselves. So there's a kind of spectrum here, I guess, and then a proportionate response according to that person's individual situation. But career counselling, which is one of the things that I specialise in for doctors, is a structured evidence-based process that's drawn on occupational psychology that looks at your wants and needs from multiple different perspectives, different lenses, really, to essentially build up a really rich picture of what it is that that person wants and needs in their career, and then, can look at what all the different options are. But the mistake that I see, I suppose, the most commonly is that people try to fit themselves to an option rather than taking the step back and actually working out what it is that they want and need first, and then looking at the different options. So that would be just something, a principle that anybody could follow, like, only think about the options after you've got a bit more clear about what you're actually looking for, because otherwise what happens is there's a bit of a tendency to go out of the frying pan and into the fire, like, oh, it sounds like it would be a good fit, but actually haven't really done enough of the groundwork to feel confident that they've made the right decision.
It's really important to take time and space to think it through, because oftentimes I see people just do something and then realize that's not for them, and they've already invested in that, and it's not a really good experience then for them. So tell us then, in terms of the GPs who you've worked with who've had some issues where they're thinking about leaving, what are the things that they've managed to do to be able to maintain their family life and work life and be happy in terms of juggling both?
Yeah, so it's very challenging, isn't it, having family responsibilities and working as a doctor, whatever stage of your career and whatever the family circumstances, whether it's caring for elderly parents or whether it's having a young family yourself or any other variation of additional kind of caring responsibilities. And actually, it's really hard, even if you're probably a single adult and you don't have those additional caring responsibilities. It's medicine has always been a challenging career. But in terms of how people can cope with that, I think it is about that needs assessment. So what do you need to be able to do a great job at home and at work? Because that's the kind of the tension, isn't it? That people feel, I don't really get to do either well, and they feel kind of torn, like I don't get to be a good parent, say, and I don't get to be the clinician that I want to be because I'm always kind of trying to juggle both of these. So it's really understanding, well, what do you need and where can you draw in extra resource or help from? So often, I see in doctors, we become a bit of the kind of the lone ranger while we kind of socialized by medical school and kind of junior doctor training to have the answers and to be out there making things happen for ourselves. And sometimes that is about asking for help, perhaps negotiating if you have a partner around, can't kind of manage for us to go out together without a babysitter, say, or, I could go out once a fortnight and we could alternate, that kind of thing, so that you are getting something that's a little bit of time for yourself there. So kind of negotiating at home around what you need. And then in terms of practicalities of I know it's really, really hard, and it really reminds me of when my childminder told me that daughter was in reception, and I just remember how trying to have robust support systems around you, I think, is really important. But understanding your own needs and valuing your own needs, I think, as well, as doctors, we're often socialized not just to be the lone ranger with the answers, but also to, the people first, or as human beings, we're hardwired to, be in the tribe supporting each other. We want to do that. We don't want to be out on the savannah on our own, be in the tribe. And sometimes we kind of go a little bit too far to support other people at our own expense. So recognizing we have needs, it's okay to have needs, and what are they and how can we practically get those needs met as much as possible, and negotiating around that at home and at work is kind of the way to do that. But there are no easy magic wands here. And I think some of it is like accepting, right, this is going to be a difficult, challenging time of my life while my parents are elderly or my children are young or whatever. And, it's going to be difficult. It's not going to be easy. It's not going to be clear cut. It's going to be that sense of juggling and kind of trying to muddle through, but muddling through in as skillful way as anybody possibly can in that situation, recognizing that there is no perfect solution here. Taking care of yourself, like being able to do your own kind of well-being risk assessment. Kind of really easy model that I like to use with clients is RAG rating, red, amber, green. So starting to recognize in yourself, where am I? So green might be like, you've been on holiday for a couple of weeks and kind of you're feeling like super relaxed. Amber might be kind of typical day at work, say, but red could be, when do you start tipping over into that and start to recognize sooner, and then have a clear plan around what you do at each of those different stages. And over time, you can learn to make that much more nuanced. So rather than red, amber, green, a kind of 3-stage model, like maybe a kind of 0 to 10, 10 being, absolutely in the red, like one being like totally relaxed, but recognizing, oh, right, I'm a 6 going into a 7. So what do I need to do to stop things escalating now up into a kind of 8 or 9? But that self-awareness around recognizing your own, what you might call stress signature, the pattern for you, the kind of thoughts, the emotions, the feelings that come up, the body sensations, what you might notice in yourself, how that impacts on your behaviors, what's visible in the outside world, and starting to recognize and kind of match that to different stages of levels of stress is a really helpful thing. And when I was an occupational physician for a while, that was something that I absolutely used to use all the time in the occupational health setting.
So yeah, it's really important to highlight that, because to some extent you might find that this is something that might be normalized. People feel like if they're overworked, this is part of the job, and they feel stressed, but they think that that's part of it. But it's really important to be aware that where your level is at, and to know when you need to do something to move to a space where you feel less stress, because having this stress over a period of time, which is chronic stress, can be bad. So tell us then, once somebody's identified that there's something that's not working, then what's the next step? That are things that they could do to help themselves?
The first step is the noticing. Okay, so that's absolutely the first, absolutely key to this process. And then having people that you can go to for help. So, an employer has a duty of care to its employees to provide a reasonable workload. And, stress risk assessments is something that all doctors should be asked to engage in, and action planning around that. It's required by law under the Health and Safety at Work legislation to do risk assessments for any staff that's going to be exposed to any occupational hazard. Stress is an occupational hazard, and, every doctor is exposed to that. So you should already have some kind of system in place in an ideal world. I'm not saying that is what is actually happening in reality, but what should be what's already happening. So ideally there is some kind of line manager that you can go to raise your concerns. Obviously, if you're a partner, a GP partner, and it's a team of partners, then perhaps there might be somebody who's like the HR lead, or just one of your other colleagues that you can talk to. But trying to struggle on your own is kind of not a helpful behavior. I think there's a lot more kind of awareness, isn't there now, that a lot more normalization of talking about feelings and how people are coping. But I think there's still a lot of shame. People feel a lot of shame. Doctors are socialized into that kind of, like I was saying, the Lone Ranger and the being strong and the being there for everybody else. And so I think, it goes very deep into a doctor's psychology that is who they need to be. So I do think there is a lot of sense of shame if you do ask for help. So an antidote to that would be self-compassion, the compassionate hand, so taking your hand, this is a third wave CBT exercise, but taking your hand, putting it on over your heart, on your other hand, on your cheek, on your leg, on your arm, it doesn't really matter. But what matters is that you notice this is difficult. It's really hard to be a doctor and to be struggling with how I'm feeling, and to be having concerns about my work or the way that I'm working, and that it's making me feel under pressure or under duress. This is hard. The touch is really important part of this kind of compassion focused approach, because that releases the oxytocin, serotonin in your brain, which is an antidote to the fight flight response that allows the self-soothe, that brings your stress levels down. So then you can work out a bit more clearly, what is it that you need to do? So what do I need to do now? This is really hard. I need to take care of myself. This feels really difficult. Allow yourself to name the feelings, and then what can I do here? Okay, it could be like just going and making a cup of tea, or it could be having a conversation with somebody, but knowing that there's a range of different people that you can go to, and being proactive, planning that safety net sooner rather than later, so that it's there. You've kind of woven your parachute in a way. It's already there. You already know what you're going to do as and when that situation arises, because it is going to happen to everybody during the course of their career. Some degree of burnout, and maybe very mild, and hopefully that it will be, because we've got the strategies in place to recognize and nip things in the bud early, recognizing this is a real risk, and having a plan, who you can talk to, and knowing all the different places where you can get support from, maybe mind mapping them, so that you've got maybe at the end of this session, for example, you mind map all the different places where you could go for help as and when you need it. And then as and when you do in the future, even if it's 5 years in the future, where's that piece of paper? And you know where to go to find it. You've got that safety net in play.
In your experience, are there any mindset shift that has been helpful when somebody go through this? I understand that accepting it it is really important so that you can take the next step to respond to something if it's really been difficult. But are there any mindset shift that you have seen?
Well, I think there are skills that we can learn that help us be more effective and more skillful in how we handle difficulty. So in terms of mindset, I guess there's maybe something around that, a bit like we were talking earlier about that going up on the balcony and looking at the bigger picture, but in terms of how you lead the team, but also around yourself, being able to see your own context and perspective is perhaps helpful around that. But I mainly use what's called the third wave CBT, third wave cognitive behavior therapy-based approaches, where there are specific psychological processes that we target to, which is very evidence-based in terms of, there was a review in systematic review and meta-analysis in Nature Human Behavior a couple of years ago that showed that these acceptance and commitment therapy-based approaches, say for example ACT, was very effective in terms of promoting well-being. But there are these 6 processes, and at the heart of them actually called the skill of mindfulness, the being present, being aware, noticing what thoughts, feelings, body sensations are arising for us, and then being able to choose effective interventions based upon that. In terms of mindset shifts, I guess the skill, we're not trying to kind of pretend that the thoughts, feelings, sensations aren't there, which is a bit like kind of pushing a ball under the water, a little bit second wave cognitive behavior therapy, which is where you kind of intellectually argue with yourself a little bit around this kind of thing. Acceptance-based approaches are much more helpful, like, okay, this is difficult, how am I going to work with this? I'm not trying to kind of push it away and kind of argue with myself, I shouldn't feel like this, it's wrong that I feel like this. Is helpful with people, but this is hard for me, I need to accept that this is difficult, and there's some kind of common humanity there. It's difficult for every doctor in this situation, and how can I take best care of myself in this situation, I think is maybe it's a kind of compassionate, self-compassion mindset shift would be one that I would say is definitely an effective way to cope with this difficult situation. And that doesn't mean self-compassion like, oh, anything goes, self-compassion to the point of being unhelpful, but it's about honouring, right, these are difficult feelings and how am I going to deal with it? So it's a both and. We call that a kind of polarity, a dialectic. Things are difficult and how am I going to move out of it?
That's a good reframe. So yeah, to accept, be a bit more objective, as in how you're assessing what's going on, and then thinking in a positive attitude as to how you're going to work your way throughout these challenges.
Yeah. So what's helpful? What can I do that would be helpful in this situation? So seeking professional help, from a therapist or a clinician might be a helpful thing to do. Equally, making a cup of tea might be a helpful thing to do. But there are also unhelpful things to do that we can, as human beings, that people get stuck rather than pathologizing necessarily. Like, we get stuck in different patterns of thoughts, feelings, behaviors, but we can learn skills that enable us to manage things in a different way.
A lot of people talk about well-being, and this is something that might trigger some people. Have you noticed any changes in the aspect of how somebody can build their well-being? Because it seems to me that sometimes telling somebody how to be looking after their well-being might not be that helpful in some circumstances. What are your thoughts about that?
Yeah, I guess there's something around telling people as an approach, as it telling adults what to do or how to behave that does produce a defensive reaction, isn't there? So something around the awareness raising and invitation based approach that perhaps is kind of a helpful way forward here. But the evidence base is positive mental health and presence of mental illness aren't two ends of the same spectrum. There's a 4 quadrants, what do you call it, a 2-way continuum. So there's positive mental health, high mental health, a high well-being, and low mental health is different. It's like on a 90-degree axis from presence of mental illness and absence of mental illness. So we see a lot of people who are what's called languishing. This is the Corey Keyes model. They're low mental health but absence of mental illness, and that's where I think a lot of doctors, certainly a lot of clients that I work with, people that come to me, they are in that. They're obviously you can have high positive well-being and absence of mental health, and that's the flourishing quadrant, and that's where obviously we would want most people to be. But also you can have presence of mental illness and positive mental health. There is data that supports that is possible. Yeah, that's just a kind of another framework to be thinking about when you're trying to maybe think about yourself and where you might fit around that. But in terms of how to raise awareness with people, I think a lot of that is about the role modeling, the culture of normalization, to find things things difficult, because generally I think when somebody does react in the way that you described there, Owen, it's probably because there's a kind of underlying what's called a schema in terms of rules that somebody's internalized from their kind of childhood and adolescence in terms of how they need to be in the world, and that it's threatening if you're not meeting those standards in some way. So if you're kind of getting that defensive reaction, it's probably because, if this is a colleague, then this is about normalizing the culture and inviting somebody rather than tell people. Too often though, recognizing, sometimes people are ill and lack insight and aren't well enough to work, and that's a whole kind of different question, isn't it, in terms of supporting a doctor who is ill and lacking insight. But there are things that we can do to intervene before anybody gets to that stage, because there's never been more effective evidence-based interventions in terms of promoting well-being and preventing mental illness than there is now. So we do have really evidence-based meta-analysis level clarity around what to do. We've got nice guidelines around mental health at work that were revised last year. Preventative stress prevention coaching was one of the things that's recommended as part of that. So there are specific evidence-based interventions that do make a difference at an individual level, but always, with my public health hat on, is always in the context of the wider system that also needs to be addressed. It can't always be. It's a both and. Support the individual in terms of giving them the skills that they need, but also addressing the wider context that people are working in.
This is very important to highlight because what we've discussed so far is focused mainly on the individual, possibly at the organization level to some extent, but there are things that's beyond our control, and a lot of things that's beyond our control can affect negatively on the work and what's going on. And this is what seems to be driving a lot of GPs out of the profession, because they are saying that maybe they are not able to provide the care they want for their patient, and internally it's affecting them and they're feeling like they're working in a very unsafe environment. How do you think about that?
That's often real or perceived moral injury, isn't it? I think this is how people experience it. It's a kind of a real clash with their values and what they stand for and everything that they've been trained to do. And it is extremely distressing. And I think it's a form of workplace trauma to be feeling like that. And it's terribly sad and distressing that is how many health professionals feel or have felt in recent years. I think it's a very serious issue that we as a country need to take very seriously.
So it's important to think about what you've described today, as in how somebody could flourish. Last words of advice for somebody who's listening, who might be an early career GP or somebody who's struggling at the moment with a workload. So tell us what are a few steps that you would say would be helpful for somebody who might not be depressed but is just languishing?
I think first of all, name it to tame it, recognize this is what's happening. Actually, I'm not feeling great. This isn't okay and I want to do something about it. With some self-compassion as the next step. This is really hard. It's really hard for me as a doctor. I've worked so hard for all of these years and here I am and I'm feeling. And then that kind of taking a step back to think about, well, what can I do here? What do I need? So if you're feeling frustrated, resentment, these kind of anger type feelings, it's probably because your needs aren't being met in some way. So what is it that you need? It's data. It tells you, you're feeling frustrated about this, and this. Well, it tells you, well, you need more of this kind of thing so that doesn't happen. And then work out, well, who can you talk to see what you can do in terms of affecting change here. But the more clear you can be about what you need, the more somebody else will be able to help you. So say, for example, you go to your practice manager or, a more senior GP in practice, then making a clear request using a form of communication like non-violent communication. I need, please will you. So I need more time to process my admin. I need more time to process my admin. Please will you enable me to have an extra hour on a Wednesday morning so that I can get on top of things. A clear request. And a request is something that somebody can say yes or no to. So it's not a demand, but it's a request that you can negotiate around. So that would be the next step. See what you can negotiate there in terms of getting your needs met, and then see how far you get in terms of being able to make things better. But if it's still not improving, then it's really important to recognize that you have tried to affect change here, and there's perhaps a little need to kind of escalate things. Actually being really clear, I am really struggling here, and I am really concerned about my ability ability to continue to practice safely and effectively in this role, I would like you to help me to make a plan about how we can make this better together, because I am committed to doing, my own best work here. And for me to do that, I also need this from you. So it can be really difficult to have those conversations, and really very daunting and very frightening, where there's a kind of power imbalance, or you're, with an employer, or you're feeling you'll be judged, or that your employment or your reputation is at risk. It's, this is why doctors are often quite late at seeking help, because they've got all of that psychological stuff to deal with. These are some ideas that I hope would be useful.
Great. Thank you very much for sharing your insights with us, Dr. Fiona Day. So where can people connect with you?
I have a website, www.fionadayconsulting.co.uk, and LinkedIn, Twitter. I'm very rarely on Twitter, but I am on there from time to time. Those are the main ways. But I have a newsletter as well. So if you sign up for my newsletter, which is on my website, then you can get 3 hours of free CPD with CPD certificates as well, in terms of giving you a chance to take a step back and look at your career and your work life and how that's going, and some reflective exercises. I call it the Health Career Success Programme. So yeah, that's freely available for anybody who wants to take part in that.
Thank you very much for sharing your insights with us. You can click the link down in the description below if you want to go and visit the website. Take care, everybody. Bye-bye.